Hi everyone. Today will discuss about my favorite sports, that is cricket, and injuries associated with the cricket. So I love cricket a lot. I'll play regularly. So every Sunday I'll keep myself to play cricket. So this is about injuries. Frequently I have seen in cricket, and we'll discuss about them. So most common injuries we'll see is around the knee joint, shoulder joint, and around the elbow joint, and ankle as well. So first thing, when we come to shoulder joint, so because of in bowlers, because of the bowling action, if the bowling action is not good, and when you are fielding and when you are throwing in a wrong posture, lot of people will have this shoulder impingement and shoulder pain, that is difficulty in doing overhead activities and difficulty in throwing, and this is called cock up phase, the difficulty in throwing in this phase. So the reasons for this thing is that will be that we need to evaluate if it is a acute pain. If it is not acute pain, you can wait for 3-4 days for the pain to subside, but if the pain is not at all subsiding, you need to go for evaluation. So in the shoulder, we'll call it as a slap tear or slap superior labrum anterior posterior tear, that may be seen in these cricketers in the shoulders because of wrong throwing action. So that needs to be evaluated. If we neglect that thing, that tear may increase in size, and pain, difficulty, all those things will increase. So that one thing in the shoulder we need to see. If only impingement is there in the shoulder, then regular exercises for the shoulder strengthening will help. So that is one thing. For this thing not to happen, you need to have a proper bowling action and a proper throwing action. So that is important. So next, when we come to elbow joint, in elbow joint, we see lot of patients complaining of pain either on the outer side of the elbow or on the inner side of the elbow. So most commonly, when we see in fielders who are very good fielders, we see thrower's elbow. So thrower's elbow means pain around the inner side of the elbow because of frequent throws. The muscles which are originating from here on the medial epicondyle of the elbow, there will be small minute tears that causes this elbow pain, that is thrower's elbow. So this, if it is there, then rest, ice pack application, and medications, later exercises, and proper throwing action, that is what important. And next thing is, in some people, when they suddenly bat after longer durations, long time, so when they practice over 2-3 hours continuously, there are a lot of people, they say that I heard a pop around this outer side of the elbow, and pain started after that thing. So this is a component called as tennis elbow. The ligaments which are useful for extending the elbow and fingers will originate from the lateral epicondyle of the elbow. So there, with the minor tears, these things will happen. So this is called tennis elbow, this is called thrower's elbow. So both these things has to be addressed as early as possible, otherwise it will continue, it will become a chronic issue. So physiotherapy exercises are very, very important, and proper throwing action, so that is what important. So coming to fingers and wrist joint, whenever you hold the ball, and sometimes whenever doing fielding, your fingers may stuck in the grass. So there are chances of dislocations, injuries, fractures when a ball come and hit the directly. So any injury, if there is a swelling, pain is there, X-ray is mandatory to rule out any hairline fracture is there or not. If it is only sprain, 1 week or 10 days of rest in fingers, body strapping with the other finger will mostly help. So if fracture is there, splints, or in case of any joint is involved in the fingers, so joint fractures are always complicated, like that will cause the restriction of movements if not treated properly, and any dislocations has to be addressed as early as possible, because if it is not reduced properly, movement restrictions are inevitable. So finger injuries also you should not neglect. Whenever injury happens, better to have a X-ray and rule it out whether fracture is there or not. And soft tissue injuries, they'll heal when you give a proper rest, ice pack, and rest is the main important thing. So these things we need to look in the hand. So if we have finished upper limb injuries, then we'll move on to lower limb injuries. So next most commonly seen injuries in the lower limb is around the knee joint. So knee joint injuries are whenever you're running fast and stopping and changing direction, suddenly your knee may pop up and you may fall because of that slip. So that causes injury around the knee joint. So this most commonly what ACL ligament injury will be seen in this kind of injuries. When the injury happens, definitely there will be pain, swelling will be there, you will not be able to put complete weight on the leg. Same thing like X-ray, when the pain swelling is severe, you're not able to put weight. First thing is to go for a X-ray, rule out whether a fracture is there or not. If fracture is not there, give rest for 1-2 weeks, that your doctor will advise anyways. After that, we'll evaluate for the instability, like ligament injuries will be evaluated after 1-2 weeks. So if any doubt is there on clinical examination about the ligament injury, then we order a MRI, then we rule out any ACL tear, PCL tear, or any meniscal injury is there. So everything will be ruled out with a MRI. So depending on the tear, either if tear is not there, conservative management means medications, exercises will help, and then if tear is there, arthroscopy surgeries will help for those things. So those are the most common knee injuries. So next, coming to ankle. So sprains are most commonly we see whenever the ground is wet, or when you are not using a proper shoes, without spikes you are running, and not a proper cricket gear when you're not using a proper cricket shoes, then skid and fall and sprains will commonly happen. So ankle sprains are one of the most common injuries associated with cricket. So definitely there will be lot of swelling, and same process has to be done. Whenever injury happens in the ground, try to immobilize the injured leg, ankle, knee, or anything. So apply ice pack immediately, whatever it is. If you get ice pack, any cool water bottle or anything, you need to just apply ice pack for some time. Then crepe bandage, you need to apply crepe bandage for compression. So you are not allowing the swelling to increase in size and to reduce the pain. Then you need to go to hospital, consult a orthopedic surgeon, go for an X-ray. If only sprain is there, depending on the sprain, you may need a immobilization, whether with crepe bandage is enough, or ankle binders or immobilizers. Or if there is a severe pain and swelling, then we may need to apply a plaster of Paris, POP, for 2 weeks. So depending on the pain, so we'll remove the plaster after 2 weeks. But in case any fractures are there, they need to be addressed for you to recover well and come back to your sport again. So sprains, you should never neglect sprains, and if you are neglecting, if you are not immobilizing, and if you are doing all the activities routinely after the sprain, that pain will bother you for long time. So early treatment, first 2 weeks are very, very crucial. So immobilization is the most important thing. So you need to treat early. So next thing, when we see in soft tissue things, hamstring injuries are most commonly seen. In few people we will see quadriceps injuries, quadriceps tears we will see. Because of fall on the knee joint directly, patella fractures are most commonly seen. So all these things will be seen in routine cricket injuries. In the hip, pain will be there in hip joints for some reason. If you are not doing pre-cricket warm-ups, if you are not doing exercises regularly, then hamstrings, any soft tissue sprains or anything, calf strain, then all these things will routinely happen. So cramps also we will see regularly. So for this, You need to have a proper warm up before the match, and after the match also you need to do some exercises and give rest after the match. Next you need to do strengthening exercises regularly to avoid injuries. So basic thing is you should have a proper cricket gear: shoes, pads, gloves, proper gloves, helmet is must. You need to wear helmet, otherwise we have seen a lot of injuries around the face and head. So wearing helmet while batting and keeping is very important. So all those things you need to be very careful. Any injury, anything is there, you treat it immediately. That's how you'll come back and play cricket regularly. Discuss about the recovery after a soft tissue injury or bony injury. So bony injury varies from a small hairline fracture to a complete displaced fracture. If a complete displaced fracture is there, we need to intervene and we need to do a surgery, whether whether it is in upper limb or lower limb. We need to fix that fracture and get it back to the proper alignment. So after a fracture fixation, for you to completely put, if it is a lower limb fracture, for you to completely put weight and walk, it takes around 2 months time. If it is a hairline fracture, we'll immobilize it. If around the ankle you have a hairline fracture or in the hand you have a hairline fracture, 1 month we'll immobilize with a plaster, and after that we'll remove the plaster, will allow you to move and get back your strength. So weight bearing and using your upper limbs, all those things after 4 to 5 weeks. So any soft tissue injury, depending on the soft tissue injury, grade of the soft tissue injury, if it's a mild sprain, it will recover in 3-4 days. If it is in a stage 2 or stage 3 sprain, depending on that, it takes from 3 to 4 weeks time. So first thing to rule out is whether it is a bony injury or soft tissue injury. Depending on that, your recovery period will vary. So early intervention, early diagnosis, and you'll go back to your sport early. So I think I have cleared all the things. So be fit and play regularly.